Hi, this is Gene Ransom, and I've had a lot of people ask, what's the game plan for reopening Maryland physicians' offices after COVID? Um, as everyone is probably well aware, um, as a result of orders from the governor and from the health department, physician offices are only open for urgent matters. And with regards to elective procedures, the Department of Health gave out this very handy chart which explains what can be done and what cannot be done while we're in the state of emergency. Um, essentially, though, if you really boil it all down to, if it's an urgent matter, if it is a life-threatening condition, the physician is allowed to do it, and if it is not, if it's truly elective, it must be put off. And office visits that are not urgent should be done with telemedicine, and that's the manner under which we've been practicing under for a little more than a month. And all this information is available both on the Department of Health webpage and on the MedChi webpage. The Maryland State Medical Society has a bunch of information on this. And a lot of folks are saying, hey, when can we get going again? How are things going to work? Well, Governor Hogan kind of answered that question with the document he released called the Roadmap to Recovery for the State. And I have the link here where you can go to see that. But essentially, it outlined exactly what and how we would reopen the state of Maryland, and physician offices and healthcare procedures are included in that plan. In order for things to start moving and us to go into the 3 stages of recovery, there were 4 building blocks that the governor said uh, have to be in place in order to move forward. Expanded testing, increased hospital surge capacity. We could put a check next to that one. We're in good shape on that. Adequate personal protection equipment supply, and increased contact tracing. I don't know where we are on contact tracing, and we are clearly expanding testing. I don't know where we are exactly on that or what level is required, but that's moving in the right direction. The hospital surge, they've done a very good job building that out, and we're in good shape. And I'm not sure where exactly we are on PPE. So essentially, in the first stage, once we hit those standards and we've seen a plateau and a downward trend for 14 days in key indicators, we will move into stage 1. And stage 1, under Governor Hogan's roadmap to recovery for the state, includes allowing some elective surgery and more flexibility in non-surge areas and physician offices. It is highly likely this could be done in certain areas and not in others. That was made very clear in the governor's press conference and Dr. Inglesby's comments. And it was very clear that they were going to probably do ambulatory surgery out of hospital areas first, which makes sense because we want to make sure the hospitals are available for surge capacity. For more details on exactly when things will happen, it's really worth looking at the governor's roadmap to recovery, which the link again is on this slide. MedChi, the Maryland State Medical Society, along with the Ambulatory Surgery Society, the Society of Anesthesiologists, the ENTs, the Maryland Patient Care and Access Coalition, and the Maryland Orthopedic Association wrote a letter saying they wanted to be part of the game plan on how we would reopen elective procedures. And again, citing from that letter, and you can read that full letter on the MedChi webpage, www.medchi.org, they wanted to ensure these procedures resumed, it would be done in a safe and effective manner, ensuring that healthcare workers and patients are protected. And the letter also included a couple different statements or materials from the College of Surgeons and the College of Anesthesiologists, Preoperative Registered Nurse, and the American Hospital Association, and some other documents. So the medical societies and these other organizations are hoping to be part of a discussion over the next 10 to 15 days to figure out how this is going to happen and where it's going to happen moving forward. So can't tell you exactly when things are going to reopen. There is a game plan, and there are clear conditions that need to be met. If you want to see where the data is, so you get an idea of what our trend lines look like, you can go to the Maryland Department of Health webpage and look at it and see. But we are beginning to think about reopening Maryland, and now hopefully you have an idea of what the thought process is and what are the key indicators that will be taken into consideration to make that decision. Again, if you have more questions, you can always look at www.medchi.org, and you can reach out to us at MedChi, and we're more than happy to help you as we try to figure out and deal with these complex times under COVID. Thank you for listening.